The one.
Yeah.
Okay, our apologies to all of you who have tuned in. We understand that the link wouldn't be virtual if we didn't have a technical difficulty. So the link is, or has at least been transferred over. So I hope that all of you are now able to hear us. We understand the link went defunct right after the sports question. And so I think what we'll do to continue is we'll go straight to where we were with masks. Let's see, we had, well, we did discuss too, I suppose, access to campus, which Dr. Avegno reviewed, just that it's a sound practice for preventing communal spread. The question was over what symptoms should parents assess their children for each day, and this is especially for school, especially when they have to consider keeping their children at home. And then we had some questions around that cluster that had to do with the flu season that you alluded to and the need for vaccination.
Right, and just to answer real quickly, what symptoms should parents look for is really any symptoms. COVID can present in a variety of ways. And so if your child is saying, my stomach hurts, I have, some diarrhea, it's likely it's not COVID, but it's certainly possible that it is, in addition to respiratory symptoms and sore throat and that sort of thing. So I would encourage parents to really adhere to their schools, when not to send your kids to school policy, and be in touch with your pediatrician and let your healthcare professional make the call on whether your child needs a test, whether it looks like, it's something else and don't need to worry about COVID. But just err on the side of caution when your child is having any kind of symptoms.
When we get there, of course, we have to all contend with the notion of wearing masks. And we've been doing this as a community when we're out in public, or should be doing this as a community when out in public. And there's been some evolving guidance from CDC to state on this. One question that came up is, wouldn't students younger than 8 be safe wearing masks? What is the rationale to limiting the age requirement?
Yeah, it's really, I think, a risk-benefit calculation, which we in the healthcare profession have to make all the time. I believe that in the BESI plan, it's required / strongly recommended for 3rd grade and up. In the governor's mandate that he announced a few days ago, and we're all very grateful he did, it's recommended for ages 2 to 7. I think that that's sound. I think that many of our young children can successfully wear a mask, especially when that behavior, as you said, Joe, has been modeled now for several weeks. I'm really, really, really proud of New Orleanians. When I'm in New Orleans, people are wearing masks. When I am elsewhere, driving not that far away, it's been very spotty. And so I think as a community, we are setting an incredible example. And so I think that we should encourage our younger students to wear masks as much as is feasible. Now, we know that especially our little ones, some might wipe their nose with the mask or throw it at someone, or, dip it in mud on the playground. And at that point, the mask is probably more of a liability. So I think it's just the need to be flexible. We want to model good behavior. We want to try to have all of our kids wear masks. But we do understand that especially with younger age groups, it might be a little bit more of a challenge.
Yes. The 15-minute rule, and I think you said 10 to 15. The latest guidance I think I've read was 15. Mm-hmm. And what I'm talking about was 15 minutes within 6 feet with close contact. Mm-hmm. As a possibility of exposure. Should that determination of close contact be made irrespective of whether the person or both parties are wearing face coverings in close proximity?
I'll tell you that wearing face coverings does affect that somewhat. And that's really, that is why contact tracing is not as easy as it sounds, because contact tracers will really get into the nitty gritty of what you were doing, were you wearing a mask, and exactly how long. So it may be that in your, in discussions when you have a case, that if everybody was wearing masks and staying 6 feet apart, even if they were, in class for an hour, or maybe they moved closer for an hour, for a few minutes and moved back, that it might be safe. There's nothing that is firm. And so it's just sort of on balance, what is the likely risk? So yes, masks do really help to mitigate those distancing rules when we're talking about a contact.
Are there specific kinds of cloth masks or otherwise that you'd recommend our children wear? We've seen out and about bandanas, sort of neck gaiters, even, and of course the ear loop style. Any specific recommendations on that?
I think whatever the child tolerates most. My mom has been sewing masks like crazy, so we have a wide variety, and each of the kids prefers a different style. I know for my youngest, it's really hard to find one that fits her well. They make, if it's an ear loop mask, they make sort of little beads that you can adjust the loops, which I find is very helpful. But there's really no, face coverings. There's not a whole lot of science in epidemics, because we haven't been in an epidemic where we've had to wear them en masse like we are now. We know that they help, we know that they work, but whether canvas or linen or, t-shirt material is better is probably fairly negligible.
Okay.
And I will say, Joe, I know there's a question, or I think we talked about face shields.
Yeah, that was the next one.
Yeah, I know that for many, face shields are more comfortable. There's not a ton of evidence out there, but it does appear that they are not as efficacious as masks. So they really don't replace wearing a mask. Now, I like having a face shield when I am working in the hospital, because I just want that extra layer of protection, but I'm also wearing a mask. So if folks want an extra layer of protection and they don't wear glasses, or they think this would be better more for their eyes, then it could be additive. But as much as I wish it could be an alternative to face coverings and masks, I don't think it is.
We, as educators, one of the things we worry about, especially with our youngest learners, we know they learn so much by expression, by reading of faces. That's so important to social and emotional learning. What is the balance there in thinking through those considerations?
Yeah, it's tough, because those are also the kids you got to get the closest to, right? And the problem with face shields is that, it's not closed. And so things can get underneath it if a kid is hugging on you, or, giving you trying to give you kisses, even though we all know we're going to try to avoid that. So I think, there are some masks that have been developed they started as being developed for sign language, and they have cutouts for the mouth. They're a little weird looking, but they do provide for more of that visual feedback for a kid to be able to see somebody's mouth while they're talking. I haven't really seen any good clear masks yet, but I'm sure someone enterprising is coming up with them.
I hope so. The another cluster of questions are around travel. Is it a season when some families have been desperate to get out of their houses, of course, faculty too. And then, of course, there's the college model that we've all been following as well. So what should schools' expectations be during, really right now if they're getting away, but also during extended holidays and breaks when many typically do travel? Mm-hmm. And what about community members who are vacationing in COVID hotspots, possibly now? Should these families, faculty, and staff practice 14-day quarantine before returning?
So Louisiana is a COVID hotspot. So if you live here, you are enjoying a hotspot. Now, New Orleans, again, we are trying to hold on and not follow the steep trajectory like the rest of the state. But, there are lots of places where we can't go. You've seen that very publicly. New York doesn't want us. A lot of other places, no other country really wants Americans right now. So it's more the danger of what are we bringing to them. I think the rule of thumb is act as if everyone that you come in contact with has COVID all the time, whether you're in Louisiana, North Carolina, Maine, Colorado, and act the same on vacation as we're asking you to act here in our community. And that way you won't spread it there, because you really don't want to be that Louisianian who brought COVID to the small town in Maine, right? But then you won't spread it there, and then you won't pick it up. Right now, Louisiana doesn't have any requirements that if you've gone somewhere else, you need to quarantine here for 14 days, but that's because I think we're not doing so hot. So I would just ask, this is not going to be a year when all of us who love to travel get to do what we love to the degree that we're used to. And so, we can travel, I think, widely, safely when there's a vaccine and when we've suppressed the outbreak throughout the country.
Okay. The another question that comes up a lot, really around exposure, is of course interacting with immunocompromised family members, with the possibility of us all coming back to school. Do you suggest that students, faculty, and staff refrain from interacting with those family members after they return to school, including those over 65, so many grandparents and parents, if school resumes, as we hope it does, and with the goal of returning in person?
Yeah, well, I hope they're doing that now. I hope that all of us who are sort of circulating in the world, even in our limited capacity, are not going over to see grandma and getting close to grandma and giving grandma hugs, because that's not safe for her right now. In terms of kids, I saw a study just today that kids are generally not the source of a spread to others. They can be, but it's, a small percentage of the time. That being said, I really do think that if and when we return to classes and some semblance of in-person school, we really do need to be extra mindful of our immunocompromised, friends, neighbors, loved ones. As it is now, you should only be seeing them with a mask, physically distant, as far away as you can get in your backyard, no hugging, because the risk to them is real. And, I'm an emergency physician. I still work in the hospital. In the last few weeks, I have seen patients who were elderly and had multiple medical conditions, whose family came to visit them because they hadn't seen them in a while, and gave them COVID. And as a family member, that is something that I don't think I could live with. And so I think we just all need to be mindful of that.
Okay. You covered the next question that had to do with that, with children, hearing that children are less likely to spread the virus than adults. The question does less likely mean unlikely, and how safe are adults, both faculty and staff, in this environment, and how safe are parents at home?
Again, we really don't know the totality of that answer. I wish that we did, but we do know that, again, if everyone's taking the precautions, if children and adults are wearing masks, staying physically distanced, and not gathering, then the risk to everyone is low, and that we can continue to do what we're doing now, hopefully for a very long time. Okay.
This one's around that question of aerosol transmission. And you were talking about the face shield not being the answer we hoped it would be earlier in the spring. Given what we're learning about aerosol transmission, the question goes, is it safe for students to circulate among different classrooms throughout the day? At what point would a classroom previously occupied by 25 or fewer people be considered safe for a new group?
Yeah, that's a good question, and the science on that is evolving, and we don't have good guidance on that. As you've probably seen, the WHO has been very slow to sort of look at the aerosol, so has the CDC. So in the absence of real guidance, it's hard to know exactly what to do. Most public health professionals and scientists do believe that the virus can aerosolize. It is very different from a virus like measles, which can aerosolize up to 100 feet and is incredibly effective even at that distance. Doesn't appear that COVID is quite that dangerous when aerosolized. However, you know, if the viral, when someone coughs or sneezes, the virus comes in big droplets. Those droplets have a high concentration of virus, and if they get into your nose or respiratory passages, have a higher likelihood of infecting you. It appears that the particles of virus that are aerosolized are much smaller, so it would either take more of them or a greater exposure to make you sick. But how long they hang around in the air, not quite clear. Right now, and I had this conversation with the state today because this came up in public schools. There's not, we don't believe that, or we don't have guidance to tell us that we should change practices. But it's obviously something that we're going to be looking at really closely. And if and when it does change, then we'll have to adjust accordingly.
Okay. With that in mind, it seems that the best practice then is for us to continue to exercise the social distancing and the masking, the things that we know will work, the hand washing, of course. Cleaning, though, with the schools, I think all of us have undergone some sort of major overhaul of our practices with cleaning. One thing that we'll have to think through is how we're all partners in cleaning. Not just our environmental services or our maintenance crew and cleaning crews, but what are the basics for a teacher to keep the classroom clean of the virus? And I think that also has to do with your take on locker rooms. And then another question that's come up a couple of times is the promise of UV light technology as a possibility for cleaning and disinfecting.
Yeah, UV light does show some promise. I'm certainly no expert in them, and I don't know how practical they are for every classroom to have some sort of UV light system. But it's definitely promising, and I know that folks with an awful lot of money are looking at installing them in buildings of various sorts. In terms of cleaning, we do know more than we did in the beginning about transmission of virus from an inanimate surface. And that does not seem to be the primary way that people get sick from COVID. While yes, if you sneeze onto the desk and then someone comes and touches it and touches their nose, that is a possibility of transmission. It is a lot less likely than if someone sneezes on you. And that's different from what we knew in March. So all that to say that, it's unreasonable to expect that a magic team of environmental services is going to come in every classroom after every class and clean, every hour. But, children, even our youngest learners can easily wipe down their desks, wipe down the chairs, wipe down anything that someone else might be using pretty well before the next person comes in. That will reduce the risk of transmission that way quite significantly. And so I know that I'm sure that it is in most of your school's protocols in some way for all of us to clean our area and make it safe for whoever might be coming afterwards.
Okay. The big question, and I'll save this one for last. I know we got cut off, so I wanted it, and I appreciate you staying on a little bit longer, Dr. Avegno, and I promise to get you off after this one. And by the way, all of you who are attending or listening, we have shared and gathered these comments and will continue to gather them for Dr. Avegno, and we hope that we'll be able to provide you some of her answers as a follow-up, time permitting, of course, Dr. Avegno. There are a lot of questions about that, coming back to school, of course, given the current climate of spread. So what are the specific guidelines the city is following for knowing when it is safe to reopen schools? And I know your particular purview is the public schools in relationship to the city of New Orleans or Orleans Parish. So what are the parameters, guidelines that you're following to make that call, taking into consideration the current community transmission rates and percentage of positive tests, et cetera? Under what circumstances would the entire city or even the entire state return to remote instruction?
Yeah, I mean, I have children in private, Catholic, and public school systems, so I kind of run the gamut, and that's helpful to hear how everybody's doing it, because there are some things, I think, some milestones that we look at that are fairly standard. Unfortunately, in the state we are in now in America, there is not national guidance that helps us understand when to go green, yellow, red in terms of opening schools. There are some suggestions based on public health expertise. Harvard is doing a lot of good work out of this, as is Johns Hopkins, and I've been in contact with them and talked to them. There's a couple of milestones that they suggest you use as a guidepost, and all of these are publicly available. They're the same milestones that we use to decide, were we ready to go to phase 1, phase 2? Did we need to pull back from phase 2, as we clearly did? And if you go to ready.nola.gov, you can see these milestones. So the first one is the number of cases per day in our community, and we set that at a cutoff of 50. Is below 50, we would consider that the virus was being successfully mitigated in New Orleans. And there are a lot of reasons that we cut 50. Number one, that's a 95% decrease from our peak. Number two, it's in the range of cases per capita that a lot of the experts suggest is safe. The other things we look at are how widely are we testing, but more importantly, what is the positivity rate of those tests? And there's sort of a line somewhere between 3 and 5% of our tests positive. If we're below that, then again, we're doing a good job of mitigating community spread, and returning to in-person instruction, should be evaluated for safety, given other unique features of your community. So that's what a lot of folks are looking at. Those are what we're looking at. I have to say that for 2 months, we hit those milestones, no problem. And then when the state went into phase 2 and we followed shortly thereafter, even with restrictions, we are not meeting those milestones. And so, that's why our message has been, this is really up to us. We can determine how this goes. We were meeting these milestones when we were all staying physically distant, limiting our, what we were doing, and limiting our gatherings and social activities. When we chose not to do that, when we got away from that, is when we got to a place that is a lot more tricky in terms of what do we do and what do we do for schools. So this is exactly what I discussed with public schools this morning. I am sure it's what the Catholic schools are thinking about. It's pretty simple, and the milestones are pretty easy to understand. So that's what we look at. I know that's what the governor was looking at when he decided to make the restrictions that he needed to, and I know that he was thinking about schools. So we have a few weeks to see if our new restrictions do what we hope they're going to do. If so, then I think we'll all feel a lot better. But we're not going to be able to let up our guard if we want to be successful in the school year.
Well, Dr. Avegno, thank you so much for your time. It's informative. It's in some ways, of course, very sobering, and we need to hear that as well. But it gives us a tremendous amount of guidance as we proceed down this path to safely reopen our schools, whatever the scenarios bring. Thank you so much. I appreciate everybody. Of course, our thanks goes to all of the heads of school present here from the Louisiana ISAS schools, and of course to our community who has tuned in for this town hall. Thank you so much, everybody. Have a good evening.
Thank you. Thanks for having me.